So I want to welcome everyone to the Live Well Kalkaska Substance Free Coalition's Coffee with the Coalition Forum. This is an open and informal discussion about substance use disorders and related topics and concerns within Kalkaska County and the community in Northern Michigan. So if we could have everybody introduce themselves. I'm Suzanne Prentice. I'm the coordinator of the Live Well Kalkaska Substance Free Coalition and the prevention specialist for Kalkaska through Catholic Human Services Up North Prevention. So Belinda.
Hey, I'm already getting messages that my internet is unstable, so hopefully we can hang in there just by keeping my video off.
Okay.
So I'm a prevention specialist as well, and I work directly with Suzanne as much as I can when I can within the Kalkaska community.
Thanks. John?
I am John Superdaw. I am a peer recovery coach with Catholic Human Services, along with being kind of the outreach kind of point person also for Grand Traverse, Antrim, and Kalkaska County for Catholic Human Services. So again, I'm involved in a lot of these different coalitions and meetings and stuff. So it's really fun.
All right. Thanks for being here. And then we have Dr. Dave McGraham, and I always forget if it's Janine or Jeannie or
it's anything. Gene or Jeannie is what I can call
So they are of Dr. Dave is the medical director of Northern Michigan Opioid Consortium, or NMORC, and they're here to discuss their program and how they help to support other agencies within the area. So go ahead, take it away, guys.
Thanks. I want to pull up a few slides here. And as mentioned, I'm Dave McGraham. I'm from Traverse City. I'm a physician, and I'm contracted to work about half-time as the medical director of the Northern Michigan Opioid Consortium. Jeannie Marriott is one of the project associates, and Jean, chime in anytime on these slides. You'll recognize all of them, or at least most of them. We are a team of 4 people, including Jean and I, as well as a project director and another project associate. And we cover 25 counties in Northern Michigan, with a mission being to help coordinate responses to substance use disorders. I'm going to go through a couple of background slides. We've gotten fairly lucky, I would say, with getting federal grants. We have the RCOR, the Rural Community Opioid Response Program grants. We also have a psychostimulant grant and a behavioral health grant. These all come under our oversight organization, which is the Michigan Center for Rural Health. Why focus on these counties? The director of the Michigan Center for Rural Health, probably 6 or 7 years ago, started, and that was John Barnes, started getting concerned about what was happening with opioids and addiction in rural areas. And the Michigan Center for Rural Health is a rural focused organization, and John wanted to start figuring out what can be done to help these rural counties that are suffering from substance use disorders. And about the same time, the federal government, under the CDC's umbrella, was starting to see big issues with prescription opioids and migration to heroin, as well as an increased prevalence of hepatitis C and HIV, all in rural America. The thing that was in common with a lot of these counties and our region as well is a lot of these counties had multi-generational poverty, poor health conditions, a lot of social barriers to getting health, including transportation barriers. There were high opiate numbers being prescribed and a lot of prescription drug use. and a high prevalence of substance use disorder and increasing deaths. So that's kind of a little bit of the background on these grants, and on how we started down the path of what we're doing. We're a team of 4. We have 2 very active committees that work within NMORC. One is the Prevention Workforce Committee. The other is a Treatment and Recovery Committee. And these committees work they meet once a month. We have about 50 member organizations that we work with. We have people from those organizations on a monthly basis attending these meetings. Doesn't mean 50 people are there. It's somewhere between typically 10 and 20 that we have. And these can be members of health departments, Catholic Human Services or Up North Prevention, FQHCs, other healthcare entities, healthcare systems, recovery organizations, and others. And we have quite a few people in recovery that are part of NMORC. We also have quarterly meetings that typically have a topic of interest to the group, something about substance use disorder or something about what's going on in the region. We start all of those meetings with a person in recovery talking to us about their journey. And that was Joyce Fetro's idea as the director of NMORC years ago. And the thought is that if people in recovery kick the meetings off, that kind of helps ground us in the work that we're doing and reminds us about the core work that we're doing. Gene, feel free to chime in on this. I just highlighted a couple of things that we've been working on and have been successful with over the past year. We have funds available to support various trainings, including community health worker training, eye movement desensitization training, some other trainings as mentioned here. We help get people credentialed with MCBAP. We do mental health first aid training. And Gene is one of the key people in that regard. Jen Groover, one of our other project associates, and Gene do those courses, and they've had a lot of success training a lot of people this year. And Gene, you guys have done that for a couple of years, right?
We had a big year last year, 2023, that 110 is our record for that. So, and we're actually going back. A couple of those were with the Grand Traverse Band, like their behavioral health teams and some of their staffers. And now we're going back to help in February to do the casino and some more staffers. So we're happy to set those up wherever needed.
And you did some folks at Munson Healthcare Behavioral Health, was my recollection.
We did, yep. We did one at the Behavioral Health Center, and we had actually a pretty full class on that one. They are moving. That's the place that's going to become their residential. So it was interesting, but yeah. And we wanted to do, frontline workers, and they wanted their frontline people too. So some social, some of their security staff and receptionists and different things like that were involved in that. Important for those people definitely to know. It looks like Jenny's jumping on too. So just FYI.
I think, and correct me if I'm wrong, but the mental health first aid training really is geared towards frontline folks learning how to recognize mental health issues or substance use disorder issues and how to help plug people into a system to get help.
Exactly. It's just kind of like your first aid.
About counseling people. It's about plugging people in.
Yeah. Well, it's just like your first aid, you're kind of the conduit to help. So just like, if you found somebody bleeding and you're able to stop the bleeding and get somebody else, you're the middle person. And it helps you to recognize some of the signs and symptoms of whether there's a possible challenge that's happening or if it's moving into a crisis situation. So
if any of you know of any organizations that would benefit from this training, let us know or let Jean know. We also fund Recovery Month events. We have some dollars to do that. We've been involved in the wall-mounted naloxone safety kits, and I'll come back and talk about that a little bit more later, as well as the naloxone distribution boxes. We have gotten 1,500 medication disposal bags into rural communities, as well as medication lock bags. And Jean, any other comments, especially on the disposal bags and the lock bags, because I'm going to come back to the safety kits in a few
I know.
slides.
Yeah, we had some success. Jen's really good with data and has pulled a lot of data from the different counties. And one of the things that we recognize is that the 55 plus, even though they don't realize that they're susceptible to overdose, it's almost predominant in every county that the 55 plus is the highest EMS calls for overdose. So I've done a lot of different, in Charlevoix, I did all the Commission on Aging, and I've done a couple other groups where I'm talking about that because they just don't recognize that they're susceptible. They think of a person that overdoses in a certain way and they're not part of that population. So if you have anybody who could benefit from that, let us know too. Or if I could share my presentation and somebody else can do it to different areas.
And I don't know if we've hit the Kalkaska Senior Center, Jean, but we used to have some connections to it.
Well, I stopped there and they said they had their own program. I don't know, Suzanne, if you can speak to that or not, but so they have people that are working there on that.
Yeah, I usually go on there once or twice a year and do a medication safety presentation.
Perfect. Yeah. So if you ever need lock bags or anything like that, Tira, to share there, we've got them. We've got those supplies. So.
All right, thank you.
Some of the other work that we do, we're involved in a variety of coalitions, including this one. We also like to do provider education on substance use disorder topics, and we've hit most of the healthcare systems in the region in that regards. I like to do education with pharmacists regarding free naloxone resources. And what I do typically is walk into a pharmacy and talk to them about whether they're using the standing orders for naloxone. Those are geared towards people that are taking higher doses of opioids and benzodiazepines. We talk about free resources on how those folks can get naloxone. The pharmacist can give them naloxone through a standing order, but there are co-pays of $30 to $50 for Medicare patients and for some other insurance companies as well. If you have Medicaid, it's essentially free to get naloxone. But we came up with a handout that shows people how to get free naloxone, and I'll show you that later in the presentation. We also like to do community education on substance use disorder, and we've talked in a variety of libraries in that regards. We were supposed to be at the Sheboygan Rotary last week and got canceled because of the weather, but we're always looking to do community education because we think that's a great way to let people know what's going on with substance use disorder and help to break down stigma. We've also worked with emergency rooms around the region to make sure that if somebody comes in with an overdose, that if they leave the ER when they're stable, that they or their family members can get naloxone to take home, and every ER in the region is doing that now. We've also worked with EMS and the state that has a grant to train EMS workers to leave naloxone at the homes of people that have overdosed. Some people overdose and they're stable, they stay home, they won't come in. Others get transported regardless. EMS can leave naloxone with family members or friends or people at the scene so that if it happens again, they have naloxone available. And This is active in Kalkaska County and through the Medical Control Authority that oversees really a good part of the region. So this is out in most of the counties in the 25 county region that we cover. We also are involved in Grand Traverse Fan and Otsego Fan. I do Grand Traverse. Joyce Fetro does Otsego. And I think, Gene, I'm not sure if any of us do the Crawford Fan or if that's active anymore, but I think there was a point in time where we attended when it was active.
I don't believe it's
Am I-
active any longer.
Yeah, I don't think so either. We also try to educate members of and more regarding what's going on with opioid settlement dollars. And that almost recently seems to be a standing item at the committee meetings. Every county is doing this a little bit differently. So people are sharing who's doing what in what counties and how they're distributing those dollars. I'm a member of the Grand Traverse County Opioid Settlement Group. So we're just talking among ourselves at the meetings, who's doing what, where, how are you allocating the dollars, who's in charge of it, what programs are you out there to support? So that is an ongoing piece of work that everybody's interested in learning more about. So that's covers, I would say, some of what we do. We're always looking for opportunities to innovate and get involved in whatever might be coming up in the region. But let me just go back to basics for a few minutes, because this is what's driving some of our work, and the coalitions around the state. All the counties are aware of this type of data, but I think it's a good reminder that if you look on the left, there's 3,000 some people now in the state of Michigan dying every year of overdoses. And if you look back to the early 2000s, we were at 20,000 people a year. And if you scroll over to 2020 and over to 2021, which isn't shown on here, 2021, 2022, there were about 107,000 people in the United States that died of substance use overdoses. That includes fentanyl and methamphetamine. A lot of the overdoses were polysubstance overdoses. And you're all aware now of the danger of fentanyl. Very small amounts. It's a very potent synthetic opioid made in labs, typically in Mexico from chemicals that are brought in from China. Very small amount can kill people. And one of the big issues now is counterfeit pills. And if you look at a pill made by a manufacturing company, by a pharmaceutical company, the authentic one is on the left, the counterfeit one is on the right. And if folks are looking for oxycodone, if they're looking for Adderall, if they're looking for Xanax, and those are some of the big ones that people are buying on the street from friends typically, or people that they know, if they've got fentanyl in them, it can be fatal. And what I wasn't aware of till recently, this is information on young kids dying from fentanyl. And the typical story here is a toddler gets into mom or dad's medicine cabinet, takes a pill. If it's a counterfeit pill, if it's brightly colored, they're particularly attracted to it, but young kids are dying from fentanyl overdoses as well because of the potency of these pills. I used to, when I did community presentations, talk about overdoses and famous people that overdosed. And you recognize Philip Seymour Hoffman died of a heroin overdose. But when I was on the docket, when our team was on the docket to talk in Sheboygan, I wanted to mention these kids. And these kids are from Kalkaska. These kids died between 2020 and 2022, all of fentanyl. and 3 out of 4 were counterfeit pills. One, see, a Percocet, a Xanax. So they bought counterfeit pills, and all these kids died. And that's a tragedy, and that's something that we need to keep working on, because young people are dying in record numbers, and have to do what we can to stop it. So I always like to remind people that addiction is a chronic medical disease. It's treatable like any other chronic medical disease, and treatment can be as successful as any other chronic medical disease. And I want to just talk a little bit about the medical treatment options for addiction. I mean, we know that people that are suffering from substance use disorders, they sometimes need to be in inpatient treatment for 30 days. They need counseling, they need recovery coaches, they need to be surrounded by resources. But a lot of people really get a benefit from medication-assisted treatment. And if you look at the medications, naltrexone is Vivitrol. Most of you are familiar with methadone or have heard of methadone. Buprenorphine or Suboxone is probably the most commonly prescribed medication at this point for people with opiate use disorder. These medications prevent withdrawal, except for Vivitrol. You have to go through withdrawal first with Vivitrol, but methadone and buprenorphine prevent withdrawal, and they stop the craving, or they diminish the craving for the drugs. And what they do is they allow the brain to heal. It takes months, takes years for the brain to fully heal, but these medications are excellent in what they do. And if you look at a population of people that have stopped taking opiates, that are on medications like Suboxone, the death rate is way down. People don't overdose and die because these are partial opioid blockers. And it's hard to overdose when you're taking these medications. It's not impossible, but it's hard. But the death rate goes way down for people taking these medications, and the success rate of therapy goes way up. So this is Kalkaska County and some of the surrounding counties. And if I look at the data for Kalkaska County, there's over 200 people in Kalkaska County taking these medications. If you look at provider access, good access is the dark counties. Kalkaska County apparently doesn't have bad access according to this map. On the other hand, if I look at the patients in Kalkaska County getting medication-assisted treatment like Suboxone, getting their prescriptions in Kalkaska County, 2020, nobody got their scripts in Kalkaska County. 2022, 22 people could get their scripts in Kalkaska County. 2024, it's probably getting better because ATS has a mobile van in Kalkaska County and is the clinic downtown called Life's Work. They prescribe Suboxone. So there's probably, if I could do the 2023 data, which isn't out yet, there's probably more people in Kalkaska getting their scripts in Kalkaska County, which is a good thing. And perhaps the total number's gone up a bit as well. When I look at this data around Northern Michigan, by county, it's about 1% of the population of each county is getting medications for opiate use disorder. So it's a pretty consistent number around the northern part of the state. And again, if you go back and look at population, this holds up pretty well around most of the state. And if we look at Kalkaska County data for EMS, naloxone administration, and Jen Gruber mines this data from the EMS naloxone database and also looks at fatalities from the coroner's database, but Kalkaska County does not submit, doesn't have a coroner to my knowledge and doesn't submit to that database, so we can't share that number with you, but naloxone distribution by EMS. This is typically for people on the scene or en route that have to be plugged into this database. Been pretty stable for a couple of years, not really going down much, but probably about average for a county your size, or maybe a little higher than some of the other counties. But people are being saved by naloxone, and EMS is giving it as well as others. Part of what we do, and you've all seen this, and we'll do a little deeper dive here. We're trying to get naloxone out, or assisting getting naloxone out however we can, because it does help save lives. So we have grant funding for the naloxone safety kits. These are the red boxes, typically in a plexiglass container that is mounted on a wall. The ideal place is next to an automatic external defibrillator. This is from the Traverse Area District Library, which has a really good setup there for making these highly visible and available. We've been working on this for several years. We've got these now in 40 libraries, including the library in Kalkaska, 150 schools, public meeting places, as well as the Kalkaska Senior Center, health facilities, businesses, and other places as well. So we've got these in over 300 places, and we're always looking for other places to put these. So if you know of a spot that has, especially an AED, or is a meeting place where there's large public gatherings or people in recovery that are meeting, let us know, because we have more of these that we'd like to get out. And we typically get ideas from people that see these pictures and think about places where these might be of benefit for the public to be first responders in case somebody overdoses. And what we initially found in a lot of the schools we were talking to is they had naloxone, but they were in a drawer in the nursing office by the first aid kit. They were not available for the public to use. And a lot of the schools already had AEDs, the automatic external defibrillators, and that was, again, a great spot so that the public can be a first responder if they suspect that somebody is overdosing. We also have been active in trying to get the word out on vending machines. And this started out probably 3 or 4 years ago with the big vending machines that started in a few of the jails around the state. This was a grant through Wayne State University. Then Harm Reduction Michigan got this great idea to use the refurbished newspaper periodical boxes, and they started working to push these out. And I think there's over 100 statewide now, 30 in the Enmark region. We have some grant funding to support them in their work, and folks on our committees have been pretty active in trying to think about places where these might be of benefit. And they're in a lot of places. It's nice to see where they're at. You've got one outside of, it's either your village or township office in Kalkaska, right by the fire department. Kalkusha's got one right outside of their business, and DHD 10 has one in Kalkaska as well. Then you've got one at the Bear Lake Christian Church east of Kalkaska, and there's one in South Boardman as well. So, and this,
As well as the old Save-A-Lot. We have one at the old Save-A-Lot.
okay,
Yeah,
Great.
three of them, the coalition actually puts the kits in. We get 'em
Replenishes it?
we fill them, yeah.
Are you finding a lot of that you're having to do that a lot, or hit or miss?
Yeah, well, yeah, it depends.
Hmm.
Some of the
Okay.
locations, the last time I went through, and I try to do it, I mean, at first they were going real quick, but now it's maybe monthly, and a couple of, I think it was Bear Lake, there was only like 4 or 5 left when I went out there. So
And so this is the state map. So speaking of Bear Lake, that's Bear Lake. There's a picture of their manger and their address. So if you want to find out where these are, and this is South Boardman, the Save-A-Lot's not on here. How long has that been there, Suzanne?
Those were put up at the same time as South Boardman and Bear Lake. That was
Was
put up.
that working with Harm Reduction Michigan?
Well, I was working with NMRE and Harm Reduction Michigan, yes. Yes, we actually placed the one at the township as well, but the township office is taking care of that. They're filling that one. And then we placed the other three. And there's one in Rapid City as well that Harm Reduction Michigan placed. They placed the one next to Kalkushka. But yeah, it's not
Yeah,
called
that's correct.
Save-A-Lot anymore. It's something else. I can never remember what it is. What
Yeah,
it's
we should
called.
try to, I have some information I can send you on how to let Michigan Department of Health and Human Service, who maintain this map.
Okay.
Be nice to get that on the map.
Okay. Yes.
So yeah,
And
so
this is
that's a
really hard
map.
to find.
Actually, that one, there's a dot in between Kalkaska and Mansalona, because it's right in between Kalkaska and Mansalona.
Dave, you may want
Yeah,
to
this one.
copy, if you can, copy and paste that address. I've been putting stuff in the chat for us, but I can't copy and paste it, and I can't find it in my saved. It's just this is a really hard map to find, unfortunately.
So this is M&S Party Store. Is that the one?
Yeah, yes.
Okay, then you're good.
Yeah.
Excellent.
Yeah,
Yeah, I think
most people around here, they know the old Save-A-Lot. They know exactly what you're talking about.
okay. I mean, Kalkaska County's got a good dispersal of these.
And
A
we're working.
lot of the other counties as well. But we've got some real gaps in the region. If you look in the Sheboygan area, or if you go down into the southeast part of our region, Standish has none. So we still need to keep getting these out to some of the areas in northern Michigan that would benefit from them. So we're gonna keep working on it. And if I can get back to my presentation. So this was interesting. I was downstate this weekend. This is at a rest stop on I-75, somewhere north of Detroit. Free naloxone. This was put out by one of the county coalitions down there. And open it up, and there's none left.
Oh.
So rest areas would be really effective places to have these. And there's probably a few in the area that we should start thinking about getting these to with Harm Reduction Michigan's assistance. Yeah, and if any of you know of a business or other locations where these should be placed, let us know, because as mentioned, we're trying to support Harm Reduction Michigan in their efforts to get these out. I just want to mention a couple of other programs that you're probably all aware of, but these are resources for people that sometimes aren't well known, but the Michigan State Police Angel Program is very active, and you can walk into a Michigan State Police post anywhere in the region, and if you want to get into treatment, they will bring in an angel who's a trained person that will call NMRE or whoever they need to call and find an open treatment bed and get you plugged in and provide transportation. Now, you're not going to go in a police car, but they will help provide transportation for you. And I just think this is a great program that is probably under leveraged in some places, but it's a way for people to get plugged in that don't know how to get plugged in otherwise. Were you going to say something?
Yeah, in Kalkaska County, the hub is at the Sheriff's Department. So anybody can go to the Sheriff's Department if they need help, and they will call an angel, more than likely myself, because I'm the lead angel in the area. and we will transport.
Excellent. How many times a year do you guys do that?
Not often. I think we've done it. I think we've been doing this about 2 years, right, Belinda? I think it's been 2 years and we've had 2 people. And we didn't have to transport either one of them because it, it takes a little while and a lot of times families will transport.
Yeah.
Yeah.
The hope is that they're getting plugged in some other way. I would say
Yes.
this is a resource of last resort, but it's a resource for some people that just don't know what to do.
Yeah, and I think
Um,
some people, they do know that they can call NMRE themselves. I think a lot of people who struggle with this know that. They know how to do it. They've done it a couple of times. But this is a great opportunity for people who just don't know how to go through the process to get that help to be able to
Yeah.
connect with NMRE or insurance companies, because Michigan State Police, even if it's not NMRE, we contact the I think it's the director, and they contact the insurance company for them.
So I think this is a pretty innovative program. The state police, most sheriff's departments, city police, state police, I think are in general supportive of getting people into treatment. This is a disease. They would rather not have folks end up in jail if they can end up in treatment instead. So this is a really good way to help get people into treatment. Just another innovative thing going on in the region. These are what are called wellness response teams. This is Catholic Human Services, Up North Prevention. Got a grant to do this in the counties listed here. Kalkaska is not part of this, but basically, if somebody has overdosed or is at risk of overdosing, you can call in a wellness response team. They will go to the home of the person that is at risk, or if somebody is overdosed and they're in one of the emergency rooms in that region, and that's typically going to be Tawas, that's Ascension down there, or Alpena, they will go into the emergency room and meet with those folks as recovery coaches and start plugging them into the recovery system. This is also, it's a little bit different, but a similar model in Grand Traverse County called a quick response team. It's city limited at this point because the chief of police had started it, but they've worked with about 175 people in the past year or so. Maybe it's been 2 years to plug them into services, including treatment services, recovery services, various resources that they might need, including transportation, food, housing, and the goal, actually one of the priorities with our opioid settlement dollar group is to look at doing this countywide, not just for in the city, but the whole county, and that would require some funds to do that, but there's good support to move that forward, and that's going to be close to Kalkaska County as well. And I think over time, services might be expanded, especially if we could pool dollars and resources. So just something innovative that I thought I'd mention. And this is the handout that we had developed when we heard from the pharmacists that people couldn't afford Narcan, that needed it because they were taking prescription opioids. So we looked around the state and looked at where people can get free naloxone. And if you go to any one of these sites, they will send naloxone directly to your home for free. The first site, the Naloxone for All, next Easter out of Grand Rapids, you watch about a 6-minute video and they send you the naloxone. Families Against Narcotics, the next one is a weekly course, an in-service on how to give naloxone, and some people prefer to do more of a live course like that. Harm Reduction Michigan, all you need to do is text them and they'll get you naloxone. What's been interesting in talking with pharmacists is initially they were very interested in how to get free naloxone to patients. The Naloxone for All site you can also have needles and syringes sent to patients that are using illicit substances. And pharmacists, as I've talked to them about that, are very interested in leveraging that resource because they have clients that they know are using intravenous drugs that they would like to help prevent hepatitis C and HIV in that population. So they're now taking these handouts as much for that reason, to advise people on where to get free needles and syringes as where to get free naloxone. Some of the pharmacies, and I was just talking to a pharmacist last week in a town called Skidway Lake, and he freely will give out needles and syringes if people ask for them. No questions asked. He has to charge them for the needles and syringes, but he knows there's a population of intravenous substance users in his community, and he wants to prevent disease. He said he probably needs to do a better job in publicizing that, but he wanted these for some of the folks as well. He thought this was a good resource. And I talked to a pharmacist also in St. Helen who was very interested in using these. And when I mentioned free needles and syringes, he and his tech looked at each other and mentioned a family name, kind of under their breath, and said, yeah, they should have access to this. So, way to prevent disease, a way to get needles and syringes to people that need them. And the handouts are out there, and we can get those to people if they're interested, or feel free to, I'll put these in. I'll send you the PowerPoint, but this has been a pretty good resource for people to get Narcan or needles and syringes. So Suzanne, that's my presentation. Here's my team. Jean has been online. Jen Grover is online also. Jen, any other comments? Otherwise, I'll turn it back to Suzanne.
Yeah, I just wanted to make a correction. The photos that you're talking about that you got from Randy, those are not Kalkaska students as of yet. Those are other teens. There's stories of youth elsewhere, but they're being used to kick off presentations within Kalkaska County during sports events, during halftime, to teach or educate parents about the dangers of substances and fentanyl within them. Eventually, we will be using local students or local youth. It was just more of a kickoff.
Thanks for that. Where are those kids from? Do you know?
Different places. Randy would know better about that because he's the one that's heading this up.
Okay, in Michigan, do you think, or
I'm not sure. I could tell you
All
the
right.
truth. Sure.
I'll circle back with Randy on that.
Yeah. And then we do have a corner, Dr. Hodgman. I've spoke with Dr. Hodgman about getting the numbers out there. He said that they will do better on getting the numbers out
That
there.
would help. Yeah, I think it's up to the coroner to somehow get these into the database.
Yeah.
Yeah, I mean,
he's really busy. He's really a busy guy. So, and I know he'll be handing this down to, I believe it's Dr. Long will be taking over when Dr. Hodgman retires.
Oh, what's interesting.
Yeah.
Yes. And we just recently last week brought some new naloxone over to the library because they were outdated. Lisa Anderson got a hold of me.
thanks for doing that.
Yeah, no problem.
So I put our contact information in the chat too, as well as there are a couple of things that Enmark has going on. One is Jenny is doing and I put that in the chat too, a link to it, but there's social worker grand round. So it's free of charge. It's over lunchtime. There's 6 across 2023, starting with February 13th will be the first one. And she's doing assessment. So social work, it's clinical assessment for behavioral health care. So it would be just very interesting to learn from. We were in a Michigan Center for Rural Health staff meeting, and talking about some of the barriers that are out there. One of the ones that came up was the ASAM rules, and when somebody gets arrested and then goes to jail for 2 weeks or whatever, they're not eligible really for the for treatment at that point. So just realizing some of those barriers and that kind of thing is very interesting. So Jen, I don't know if you want to add to that. I saw you're off mute.
Yeah, sorry about that earlier. I was trying to unmute and I wasn't able to, but I just wanted to add that this webinar series is going to be our first one is February 13th. If you click the link that Jean put in the chat, this is for anybody who is a counselor, a social worker, anybody who is BAP credentialed, but also if somebody maybe doesn't need CEUs, but they're just involved in treatment in some other capacity and wants to attend. It's for everybody. And we'll be doing these bi-monthly throughout the entire year. We are doing it the first, I think it might be the second Tuesday of the month.
I think, yeah.
But it's going to be from 12 to 1 p.m. because we know that that's when the likelihood that people who are working will be able to attend. So if you know any treatment centers or just really any community members or staff or organizations, we're looking forward to it.
Yeah, so there are CEs for social workers, and you can get McBAP credit as well. And then on that link, that is Grand Rounds for the social worker section. So you might have to scroll down, but they're down there. So it just was that. And then the other thing I wanted to let you guys know is that we are doing. I'm working with the BDAI group, and we're working on organizing a jail release simulation in Grand Traverse. So in May. So those details are to come. We're still in the planning stages right now, but we're bringing more people into the loop, and we'll need volunteers for the different roles that you have to play for the simulation. So I'll share more as we know more.
I'm on that board.
Yay!
So good group. It's a really good group.
And then our summit, I don't know if Dave mentioned our summit. We do have a newsletter, a monthly newsletter comes out there. So if you're interested, you can email me and we can get you on that list. And then our summit will be July 24th, 5th. Anybody know for offhand? It's a Thursday in July. Let me look. And that will be at Treetops in Gaylord.
Got a great speaker coming for that.
Yeah, July 25th.
As the keynote.
Darn it, I've got a canoe trip that day with our youth.
So
yeah, if you can send me any flyers or anything with all this information on it, so it's easier to get it out to the coalition, I can send them out.
I'll work on that.
And I might have to move my canoe trip.
It's going to be really good, I think. So Dr. Alex Elswick will be speaking. Dave's got another provider panel that will be there. And then we have several people from the state and local who are going to be speaking. It should be really good.
Thanks. I want to let you guys know we're working on finding other locations for these naloxone distribution boxes. I believe we will be talking about that at our next coalition meeting. We're working with Deputy Roaring is going to try to speak with people at some of the township offices to maybe get some in at some of these more rural township offices. We did speak with some of the like the EMS and fire departments, and we weren't able to make that connection, and that had to do a lot to do with the medication laws that I guess or disbursement laws. Dave, were you able to talk to that doctor?
But he's on my list of people to call, so
Okay.
I'll get one.
Yeah,
I
because
did
that would
stop
be
by.
great.
I did stop by the township office last week. after I had a meeting in Kalkaska touring your ER. Yeah, and it's outside the township hall. It's not the fire department per se.
Right.
But I talked to the folks inside the township hall, and they said, yeah, people are stopping by and taking naloxone. And
Yeah, and the good thing about that is because it is a firehouse, they can order them, so and they can just put them in there. So I'd like to get some more boxes out in the more rural areas, like Starvation Lake, down on Sharon, like Sharon and what is it, 66. I mean, they're out in the middle of nowhere, and it'd be great to get some boxes out there. We're so rural. We've got them in a couple of the rural areas, but I'd like to get more out there. So, something that we're working on. Anybody else have any questions, comments?
Suzanne, thanks for having us. And